£1.5 million.
Thank you very much, Tina. Now, a strange coincidence of strike votes today saw the Health Secretary, Stephen Barclay, win one and lose one. The RCN, Royal College of Nursing, giving up the strike weapon, the hospital consultants picking it up. Let's start with the consultants, voting to strike with 86% support, a turnout of 71%. They've been planning for action on the 20th and 21st of July. The BMA had announced those dates 6 weeks ahead of time so that consultants can manage patient lists and prioritise urgent care. We can talk to Dr. Vishal Sharma, BMA Consultants Committee Chair. Vishal, thanks for joining us very much. Can you just tell us what will be happening and what won't be happening on the 20th and 21st? What shape this action will take?
Well, we're hoping the action still won't go ahead. We want to talk to government and we want to make sure that we are actually getting a good offer from government. And hopefully, if they do come back to us, we can avert this strike action in the first place, because no consultant actually wants to strike. It's all about trying to make sure the government do give us a fair offer so we can actually prevent this from happening.
Right. But just talk me through, if it does go ahead, and I accept that you're still hoping that talks will occur and it'll all be sorted before then. If, as one would say, is the default path now, what will the action look like?
So we've prioritised patient care as much as possible. So we've made sure that all emergency services will still be in place. So the cover will be very similar to that you'd see on Christmas Day or another bank holiday. So if people do need urgent and emergency care, that will be available. But what we'll be seeing is elective care, routine operations, routine appointments will be cancelled.
We know we've got a few days of junior doctor strike planned for next month. Am I right in saying essentially the consultants work extra hard on the junior doctor strike days and the junior doctors will be working extra hard on the consultant strike days?
So the consultants will absolutely cover the junior doctors' strikes. The juniors are doing a full walkout, so all junior doctors will be striking during those times, and that care will be provided by consultants. So again, we'll maintain the emergency services that patients need during the junior doctors' strike. But during the consultant action, junior doctors can't cover the work of consultants. Consultants are the most senior doctors in hospital. They are really responsible for all of the care that actually happens. And so the junior doctors can't cover the work that we do, which is why we are making sure we keep enough consultants in to make sure emergency services are running and patients are kept safe.
Right, let's just talk about the issue at the heart of this, which is pay, conditions. I was interested in this King's Fund study yesterday that was comparing the NHS on a whole bunch of different things, the health systems in 19 countries. And they do say it's very hard to compare pay because countries report it in different ways and such. But they did say, compared to countries that were able to supply data, remuneration of specialist doctors in the UK is above average, while remuneration of nurses is below average. I just wonder whether you accept that the specialist doctors, who I'm thinking are primarily going to be consultants, whether you would accept that they are better paid than average for the basket of countries the King's Fund were comparing the NHS to.
We would strongly argue that consultants are not paid at the same rates that pay for other countries that are comparable. So we are losing doctors to Australia, to New Zealand, to America, to Canada. To those are the countries where, and even Ireland, very far away, have got much higher rates of pay for consultants. So that is where we're losing people to. And the rates of pay that are on offer in the NHS at the moment, unfortunately, are not sufficient to retain and recruit consultants.
And interestingly, the King's Fund do say doctors' salaries have fallen, and in most other countries in their basket, the salaries have been increasing in real terms. They also say there's, interestingly, a high share of burnout among younger doctors, but they said they found a lower share of burnout for older physicians. I'm actually wondering whether, in the end, the consultants are all right, and it's the junior doctors that are perhaps the ones who have the hardest deal at the moment.
Well, that's not data that's reflected by surveys that are done in this country. Only last week, the Royal College of Physicians did a big census, and they showed that 20% of consultants were at risk of burnout. We know that people are leaving, we know that people are retiring early, and a lot of this is due to not only the pensions issues that have partially been addressed, but also working conditions and pay.
All right, Vishal Sharma, thanks for that, and we will see whether anything can intervene to prevent those strikes. Let's move on, though, now to the nurses, or those belonging to the RCN in England. Those that voted did want to strike, but most didn't vote, and so the strike mandate wasn't carried. There's a legal requirement for a 50% turnout, and that wasn't achieved. Now, it leaves the RCN in the odd position of not accepting the pay deal, but not taking action. Patricia Marquis is the RCN's England director. Patricia, talk me through what happens now, because there seems to be an inconsistency in the voted for positions of the RCN.
Yeah, that's an interesting comment. And actually, I think the critical thing that you mentioned is that to achieve this strike mandate, we have to do the ballot by post. There are fairly draconian, as we would describe them, laws that were brought in 2016 that both increased the mandate, but also said that strike ballots need to be done by post. And so we are we've achieved an incredible turnout of 43.4%, but that does fail to meet that 50% Our vote to reject the offer that was made, that's now become an award, was done by an electronic ballot. They're allowed to be done differently. So at that point, we had a much higher turnout of over 60%. And we do think it is significant the way the ballots need to be actually delivered.
Okay.
But
Did the consultant ballot? Did the consultants got 71% turnout? Was their ballot? Did theirs have to be?
It will have been. It will have been, absolutely. It will have been. And I think
so. It is possible to get a high turnout in a.
Oh, it is, ballot. And obviously we did get above the mandate in a number of organisations.
What might be happening is people who don't want to strike think, well, actually, not voting is a way of voting no, and it's a much easier way to vote no because you're just pushing the numbers down of voters, so you get your way without having to bother to vote.
I think that's one speculation that people can make. What we can't move away from is over 100,000 RCM members voted in favour of strike action, 84% of those that voted. So there is a very strong message from our members that they do not, many of them, 100,000 of them, remain really very unhappy. And, again, we can speculate that many of those that chose not to vote or not to vote in favour of strike, again, themselves remain unhappy with the situation that they find themselves in. And as a result of that, we absolutely will continue to raise the voice of nursing, to put pressure on the government to address not only fair pay for nursing, but also to think through the impact of not having enough nurses on patient care, which is really the root of what we and our members have been trying to achieve over the last year. It's enough nurses to deliver the care that patients need. And pay, we know, is one factor that is inhibiting the number of nurses available to do that.
But broadly speaking, now it's a done deal this year, isn't it? You have settled. The award it's no longer an offer. It is an award, and nothing happens, correct?
So for this year, in terms of strike mandate and continuing in that vein, no, we can't continue any further. However, what we will not be doing is becoming silent.
Okay.
We will be building on what we've got to continue to fight locally and nationally to achieve more for our members. Right. It's very clear that the battle's not over. We haven't won yet. It's not solved.
Okay. Is there any sense within the Royal College that this has been a mismanaged strike season? It was a very out-of-character piece of action that was taken at the end of last year when you voted to take this industrial action, and you've ended in this very curious position of not accepting the deal but not being able to take action against it.
So I think we came a long way in a very short period of time. So you're right to say it was unusual when we got the strike mandate last year. It took 106 years for RCN members to get to the point where they were in favour of taking strike action. And I think that's a really strong indication of just how difficult things are for them. It's been a long year, it's been a hard year, with many of our members having to take to the picket lines, losing pay and finding themselves, in a very, very compromised position. And it's one that has been uncomfortable for many and has been very trying. We are very clear that this ballot still indicates that very strongly that nursing staff across England remain very, very unhappy with how things are, not just their pay, but their lot, how things are working in the NHS and how impossible it is for them to be able to deliver the care that patients need.
And you've made that point.
With them, need to continue to fight.
That it's not the end of the battle. Patricia Marquis, thanks so much. RCN's England director there.